Thank you. Last but not least, Thera. We've developed a breakthrough nanostructured biomaterials platform for targeted and sustained release of therapeutics. We're initially focused in the orthopedics market, which has a total addressable market of about 6.8 billion in the US alone. Prophylactically preventing and treating orthopedic surgical site infections is a major issue today. We're the world's only bone graft substitute with sustained release of antibiotics over a long period of time. The problem is surgical site infections have a higher mortality rate, 5-year mortality rate higher than that of breast cancer, melanoma, Hodgkin's lymphoma, and other cancers as well. Our solution is Xero Syn, a bone graft substitute with a sustained release over hours, days, weeks, and months. It's tunable. We have a low regulatory risk. We're a combination drug device product. The drugs are commonly used antibiotics in use today. We expect our first 510(k) FDA approval in June of this year. We're currently in due diligence with 2 leading orthopedic companies for a corporate alliance and/or investment. To date, we've raised since inception $2.5 million, and we have a current convertible note round of $1 million, of which we've raised $500,000 to get us to our next inflection point. What we have is a material that is not unlike wet sand. It's a nanostructured biomaterial that are very fine powders, yet they're 80% porous. And with that, we can load the drug easily and mix with the water and the antibiotic. It forms, as I said, a consistency of wet sand. It's spread over the surgical site and absorbs the material that is distributed by both direction of the drug that's delivered in minutes versus the bone formation that occurs in 12 weeks. The curves here show the kinetics curve going out over 3 weeks in this particular case. The current standard today is surgeons sprinkle an antibiotic at the time of closing. It's been woefully ineffective, and the infection rates go from 5% to 50% in case. Our first indication will be with our Xero Syn plus an antibiotic, scheduled to begin sometime late this year, early next year, with a expected FDA clearance sometime in late 2026 for trauma, and then followed on by spine and revision surgery as well in the product line. We have extensive patents, both issued and pending, and 2 more patents being disclosed over the next 2 to 3 months. We have an outstanding KOL group, as you see here, both in the United States and in Europe, supporting our product technology. We're led by an experienced team that led Orthopedic to a $350 million IPO and a $350 million acquisition by Stryker Corporation. We each have totally 150 years of orthopedics and biomaterials experience in the company. A value proposition in my mind, this is a device, yet it has the potential to that of a large pharma revenue blockbuster drug because of the use of it prophylactically will be used in almost all surgeries, both in orthopedics and eventually in soft tissue surgery as well. Minimal capital requirement, low regulatory and reimbursement strategy, experienced management team, convertible note, 20% discount, 5% interest rate, and a $10 million cap. And thank you very much. I appreciate the opportunity to speak with you in the breakout room if you have interest.